I'll give you just kind of an overview of what I do for, and excuse my voice, but an overview of what I do day in and day out, and a lot of it is dealing with issues that do affect men's health. And then I just ask y'all to kind of lead me in what you want me to talk about, and whether it's problems you're having in the bathroom or the bedroom, I'll try to help you with all of those. So, but I am a urologist, as Karen said, and I've been one now for almost 40 years. So urology is really the study of the urinary tract, it's just like it says. And what we do is take care of everything from the top of your kidneys to the end of your penis. So any of those organs in between are things that we deal with. And urology is not a specialty that's limited to men. We take care of females as well. And they have just as many different, some similar problems and different problems than men do. Now, the things that we normally talk about with men's health are things like, well, we can always talk about the bad things, the habits and how they affect you, like smoking. You know, everybody talks about smoking causing problems with lung cancer, and that's pretty much what you think about. But it's interesting to know that almost 85% of all people that have bladder cancer are smokers. And kidney cancer is 3 times more common in smokers than in non-smokers. So, you know, that's one thing we look at. But we deal with issues such as the testosterone levels and how low testosterone, which we see on TV all now, how that can affect an individual, not only in a sexual capacity, but in an emotional, because men who have low T are more apt to have depression and psychiatric problems. And men who have low T also have decreased energy levels. And so that's another thing. We deal with the men specifically in erectile dysfunction and how to manage that, and some of the things that are available to treat erectile dysfunction. We take care of men with enlarged prostates and the voiding problems that men encounter. And I tell people when I'm talking to them that if the good Lord had had a different design engineer, He would have put it in a different place. Because you all know how, if you go for your annual prostate exam, what that's like. So, and it also, as it grows, causes problems with the outlet of your bladder and makes you not pee like you used to when you were 18. And then, of course, the one that everybody talks about, and one of the most common cancers that we have in the United States, is prostate cancer, with there being around 200,000 new cases of prostate cancer diagnosed every year. Another thing that's very predominant in this area, and again, it's one where we cross over the male and female, are kidney stones. And, you know, for any of you had a kidney stone? Yeah, a number of you have. And Karen will tell you that having a kidney stone is worse than having 3 male children. Is that not correct? And that's what almost all my ladies tell me. I got to tell you one little quick story about kidney stones and ladies. I walked into a little lady's room one afternoon after I'd taken a kidney stone out of her early that morning. And when she went to the operating room, she was very disheveled and miserable. When I walked in her room, and I say this without kind of any religious prejudice or whatsoever, but she was sitting up in bed. She looked like she had walked right out of a Pentecostal holiness or a Church of God meeting. had her hair up in a bun, a nice white gown on. And I looked at her and I said, Miss, do you feel better than you did this morning? She said, Dr. Hayes, thanks to you and the good Lord, I feel so much better. And I said, well, Miss, and the room was full of family, and I said, did you ever have any children? She said, yes, I did. I said, well, which hurt worse, having a baby or having a kidney stone? She kind of put her hands like this, and she said, Dr. Hayes, the good Lord will forgive me for talking like this. But I had 8 head of young'uns, and I'd have every one of them on the same day to keep from getting another kidney stone. So, you know, it's a miserable, and if you hadn't had one, and fortunately I can say I've seen a lot of people suffer with them. I've never had one. So, and if you see me, I always have a cup of tea or water or something in my hand, so that's the secret to avoiding those. So with that kind of as a very broad overview, I want y'all to tell me what you want to hear more about. Yes, sir.
What can we do to hopefully be without kidney stones, to keep from getting them?
If you are, I tell people when I'm counseling them about kidney stones, there are a number of things that cause kidney stones. And when I'm talking to people, the 3 most important things to keep from getting kidney stones are drink water, and then drink more water, okay? I'm sorry?
And more water on top of that.
Yeah, that's right. Keeping your urine as dilute as possible is one of the best things to do. I beg your pardon?
I shouldn't have said that.
What?
I said, how about a little scotch with that?
I have no problem with that. As long as your wife doesn't mind, I could care less. Now there are specific things that cause kidney stones, though, and if you are a recurrent stone former, what we do is do a metabolic profile where you collect a 24-hour urine sample, and we look for about 12 or 14 different things that either cause or inhibit kidney stone growth. And some of the things that cause kidney stones are your uric acid. If you have a high uric acid in your urine, that is, you can form uric acid stones, and high uric acid levels also promote the formation of calcium stones. If you have high uric acid levels, high calcium levels are another thing. And that is one thing. The other thing you look for is the citric acid in your urine. Some people don't make citric acid, and citric acid is a big inhibitor of kidney stone growth. So if that's low, we can raise it up. In essence, what we're simply doing is trying to raise the good things and lower the bad things. So, and you can really have an impact on people if they will do that. But still, the best thing, and especially when you live in, there's a belt that runs between Virginia and all the way down to Florida, which is about 100 miles inland right where we are, in the Sandhill region of North Carolina, South Carolina, Virginia, that is a stone belt. And I practiced for years around Florence, South Carolina, which is sort of the epicenter for that belt. Now we're in it as well, and that is a big part of my practice is kidney stones.
Portions of this program are brought to you by Fairview Park Hospital, a leader in healthcare for Dublin, Lawrence, and surrounding communities, providing specialty services through facilities such as our Sleep Center, Heart Center, and Women's Imaging Center.
In this moment, it doesn't matter if you save money in 15 minutes. It doesn't matter if your neighbor has the same insurance that you do. What matters right now is the quality of your independent insurance agent
Glad you're okay, Sarah. We'll take care of everything.
and the company that stands behind them.
Thanks so much for your help.
No problem.
Auto Owners Insurance.
Or Insurance is your local independent auto owners insurance agency.
You can go ahead. That's all right.
Different types of, they got all this different type of water, whatever now, like bottled water, and spring water.
Most people talk about or think that their well water is the problem. It's not. It's more fluid is what is. And there's one thing that's a fallacy. We always used to think or tell people when I first, and this has happened since I've been a urologist, that limit their calcium intake. Don't drink milk, don't eat ice cream, cheese, and all of that. That's totally incorrect. Within the last couple of decades, we have found that the most contributing factors to kidney stones are the amount of protein in your diet. The more protein you consume, the more likely you are to have kidney stones. If you like to put a lot of salt on your food, salt is important because if you take in a lot of salt, the way that it works, it exchanges with calcium in the kidneys, so you retain the sodium and put out the calcium. So, and the amount of fluid that you take. Those are really the three most important factors as far as dietary modifications with stone. You rarely see kidney stones in countries where they consume fish and vegetables. So if you go to Japan, you don't see kidney stones anywhere the instance that we see in the United States.
Okay, so how do you get to the erectile problem?
There's a number of things we do. First off, you got to figure out how bad the problem is. So, and there are different degrees of erectile problems. But what I do when I'm talking to somebody and determine that you have a true problem with erectile dysfunction is start out simply with the oral medications. And, the first thing, Cialis and Viagra are the two that but they're things that do work. Now, those are the best that we have right now. There have been a couple of other agents that people have used, but those are how we start. And generally what I do is start with the daily Cialis. That our tadalafil is what it's called. I'm not supposed to use brand names, so we won't do that. And that's a once a day. And the nice thing about that, if it works for you, you can go about your normal business. And then when you get in a situation where you got mama or your girlfriend, everything going, you don't have to worry about taking a pill or doing that kind of stuff. Then you have the one-time use, the 36-hour pill, and then our sildenafil or Viagra, okay?
My urologist suggested a
Sir?
shot in the penis.
Well, I'm going to let this man teach. He knows exactly what we're talking about. Let me tell you what I do, and I'll finish up. A lot of people, when those medicines came out, they were less than $10 a pill, which I thought was horrible. And as a matter of fact, when Viagra first came out, I was one of the private physicians that was kind of on their advisory board. And I said, they said, what can we do to make it better? I said, make it so that people can break it half in two. And they didn't want that. So that didn't happen. But now, if you go, even though both tadalafil and sildenafil are generic medications, if you go to the pharmacist and ask for brand name, either of those medications, they're still $50 a pill, And so what I do for my patients, and I say this without and I've been doing it for years when they started getting so ridiculously priced, is give everybody information on a Canadian website that you could go to and order the medication for literally a fraction of the dose. And I'll give you an example. The daily tadalafil, if I wrote you a prescription for a brand name Cialis and you took it to the pharmacist, it's going to cost you still almost $400. I can give you a prescription for the generic through the website that I give people, and a 3-month supply is less than $100. So, you know, there are ways, and it works just as good, and at least in my patients that I've talked to about it. The next thing, and what's your name, sir? I'm sorry? Mr. The thing that Mr. talking about with the shots, there are medications that and again, this is another I've seen a lot of things change in urology. I remember when I went to the first meeting about this shots in the penis, it was presented by a British guy, and he actually injected himself on the stage. And this is when there weren't many female urologists, and showed everybody the results of what the injection did. But what we use are drugs that are called vasoactive drugs, which means they affect the blood vessels that go to your penis, okay? They cause them to open up. Having an erection is nothing, if you think about it as a hydraulic, it is a flow phenomenon. And it's nothing but blood flow is what does it. And even men that have bad coronary artery disease or peripheral vascular disease, they'll say, "Doc, I can have a good erection, but if I get started, it goes away." That's because blood gets shunted away from your penis to feed your legs and other parts of your body that are working at the same time. So that's why that happens. But what this medication does, if it works, it dilates the blood vessels up and keeps them open because it blocks the substances in your blood that make those vessels contract. That's, vasodilation, right. And the thing about it is, and that's why the first thing, if you go to most, and I tell people that I'm seeing for the problem, if you're a smoker, stop. There are doctors that specialize in nothing but erectile function that will not see you if you continue to smoke, because nicotine is a very powerful vasoconstrictor, and it keeps those blood vessels from dilating. And even though you might not have hardening of the arteries, which the smoking will eventually cause, you know, it still is a substance that you don't need in your system. So what these do, and we generally use a mixture of 3 or 4 drugs. The ones I use are 3 Ps: papaverine, phentolamine, and prostaglandin E1. And we make it in varying strengths because in some people, a small amount will last a long time. And if it works, which it may or may not work, depending upon, number one, how much other medical problems you go in. And you got to remember that erectile dysfunction is not a one thing causes it in most people, because we know from Masters and Johnson studies back in the late 40s that as you get older, and I think we all pretty well qualify here, that things happen to your sex life. And things such as your quality of the erection is different than it was when you were 18. If you have an erection and have an orgasm, the refractory period, and the refractory period is the time that you have an ejaculation to when you can successfully have an erection sufficient for intercourse again. That increases as you get older. So when you were younger and you'd talk about going 2 or 3 times a night, you hope for once a night now. And so, and that happens. The quality and force of your ejaculation changes. I mean, growing old, it affects everything. But so we know that there are multiple reasons, age being one of them, but I have 85-year-old men that are still sexually active, And I know and people tell stories about their uncle that's, got a girlfriend that's 40 years younger than he is. So, it is but if you have, as I said, multiple factors, age being one, the other thing is that people have, I got a little high blood pressure. Well, how many medicines taken? 3. All of those can have an effect. I'm diabetic. Well, how long you been diabetic? Well, 25 years. Well, that affects nerves that go to the blood vessels into the penis. It affects the blood vessels that go because all of you've heard that are diabetic or no diabetics when they talk about peripheral neuropathy. I mean, that's just another part of the periphery that diabetes affects. So, so you've got a multifactorial thing.
We're here today at Bank of Dudley to discuss business loans. So many businesses and industries trust the Bank of Dudley for a variety of financing alternatives to suit your specific needs, from short-term loans to help with cash flow, loans to purchase equipment or facilities. At Bank of Dudley, we have commercial mortgage loans, capital improvement loans for construction or renovation. We can help with your business vehicle loans or for a small business line of credit. In other words, Bank of Dudley has your business covered. No matter what it is, you can trust the lenders at the Bank of Dudley with 5 convenient locations: East Dublin, downtown Dublin, Veterans Boulevard, Dudley, and Jeffersonville. The Bank of Dudley, member FDIC, and an equal housing lender.
The winning team is always ready.
Dublin Chevrolet!
And we got a team that can't be beat.
Go team, go!
Hustle on in and see what all the excitement's about.
Dublin Chevrolet, the only dealer you'll ever need.
With getting back to the shots, so I kind of digressed there. The shots work, and what I tell people to do when they decide they want to try it, because you tell a man you're going to stick a needle in his penis, he looks at you like, and he says, hell no, I ain't doing that. So, but let me tell you, we use a little thin 31 gauge, 1/4 inch insulin syringe to inject it. And most men, after you do it, think the shot was nothing. And most men, I mean, if you're adept with your hands, can easily do the injection. That's not a problem that I've found in anybody that wants to now. So that's one thing. One of the problems with that, and when we're getting somebody ready to do it, is that if you use too much medication, your penis can get hard and stay hard. And that's so that is one thing. Everybody said, well, that doesn't sound too bad to me. Well, it is. It is, because if you get an erection and it stays, eventually what happens is it starts hurting. And it gets inflamed, and then you start, if it's not something is not done to reverse it, then you can get changes that will keep the penis from ever getting erect again. So that's why they talk about, and I will tell you this, and you've all heard the stuff about when they talk about Viagra or Cialis, if your penis stays hard longer than 4 hours, call a doctor or get to the emergency room. I may have seen one person in the 30+ years that we've been using Viagra and Cialis that's happened to. So it's more of a warning that I've never seen. But with this medication, once you got to give something to close those blood vessels down. So when I put a shot in, number one, I'll watch you in the office. And sometimes it'll take 3 or 4 visits before we come up with the right dose of medication for each individual. So that is one thing, but I'll watch you, and if it doesn't work, I'll say come back next week and we'll put in another shot, and we'll go up on the strength. Now, if a man has an erection with the amount that I put in, and I generally start on a very low dose, and there's multiple strengths of the medication. So if I think somebody is going to respond to the lower strength of medication, I start with that, and I start out at a low dose. But if you have an erection while you're there, we have the option. I will tell people you can go home, see what happens. If it doesn't go down in the next couple of hours, come on back in. And a lot of men hadn't had an erection in so long that they want to take it home. You know, that's the thing to do. The other thing that you got to look at is something that I mentioned earlier, is your testosterone level. Even though testosterone is not necessary to have an erection, it certainly increases your sensitivity and it increases your sex drive. So low T is another factor that can be a problem.
To build up,
I beg your pardon?
do you suggest to build up your testosterone?
Well, if it's really down, you need replacement therapy, either with testosterone shots, or there are different preparations, that you apply to your skin. So, and there's not a good testosterone pill, and the reason that happens is the way that testosterone is metabolized. It gets absorbed and it goes through the liver, and once it goes through the liver, it's inactive, essentially, is what happens.
5 or 6 on television trying to sell. They got one new one will work, but I never tried it.
Well, there's a lot of things that people talk about, and anytime you're talking about some miracle cure for a man's sex life, it gets a lot of attention, and some of it is good and some of it's bogus. So, what else would you like to? Yes, let me.
Prevention of prostate cancer.
Prevention of prostate cancer. Well, the first thing is, don't be born in a family where a lot of your father and his brothers and your brother and paternal uncles. That's one thing. There's not a good, we don't have a real prevention for it. We know that the genetic is one thing. You can't do anything about that. No. And it's only on the father's side. Oddly enough, if your father or his brothers have prostate cancer, that increases your chance of having prostate cancer. And the more paternal relatives that you have, the more likely you are yourself to get prostate cancer. Oddly enough, if your mothers have breast cancer, men whose moms have breast cancer have a higher incidence of prostate cancer. And there's a lot of similarity between prostate tissue and the way the cancers look under the microscope. The diet is a factor. And well, let's see, race is a factor. We know that black gentlemen have a much higher incidence of prostate cancer than Caucasian gentlemen. And that's one reason why now the official recommendations are for screening. If you elect to get your PSA and your prostate examined, that in a family, if you are 50 years old and no family history, that's when we recommend for Caucasian gentlemen. For black gentlemen, we recommend it at 45. If you have a family history, we then start talking about starting in Caucasians at 45 and in black gentlemen at 40. Depending upon, unless you have a family history that is where 35 and 40-year-old men are getting prostate cancer, and we see those. So it tends to be the same. If your father and his brother had prostate cancer at 60, you probably need to be screened at least at 45, if not 40. Because odds are, if you're going to get it, you're going to get it about the same time. And at the time that they were diagnosed, we weren't using PSA and other means of detection. We had some old crude blood tests that weren't near as sensitive for it. Then and it was just by palpation. That's why the rectal examination was so important. But those are things that we can't do anything about our genes, and we can't do anything about our race. So, but things that you can do that affect or increase your likelihood is, it's known that people who consume high fatty diets are more likely to have prostate cancer. The recommended diet for prostate is what's called a Mediterranean diet, which is a lot of fish, white, low red meat consumption, and vegetables. That's what, yes, sir.
You said low red meat, so
what
is that?
Well, you know, some people eat beef every time they sit down, you know, and you know, it is.
That increase the possibility of boosting you having prostate, or
that's
clogged the arteries, or what?
No, it's for the prostate cancer is what we're talking about.
Hi, I'm Helen Powell. Been serving the Middle Georgia area since 1985. If you would love an exciting career, please call me. Careers in Cosmetology, 129 North Franklin Street, 272-1967.
Hi, I'm Ashley. I'm an upcoming graduate from Careers in Cosmetology. It's been a wonderful experience, and I encourage you to contact Ms. Helen Powell for more opportunities.
Hello, I'm Christy at Careers of Cosmetology. I've recently enrolled here and I'm excited about the opportunities that lie ahead.
Hey, my name is Daphne Jackson. I'm excited to be enrolled in Careers in Cosmetology. If you would like this opportunity, contact Careers in Cosmetology.
Hi, my name is Caitlin. I've been enrolled in Careers in Cosmetology for about 4 months now. I'm really enjoying it, and I think if this is the career for you, you should definitely come see Ms. Helen Powell.
Careers in Cosmetology, 129 North Franklin Street. Our number is 272-1967. Give me a call.
You put your mower through a lot. All that back and forth on all those acres can add up to thousands of miles. That's like mowing cross country. It's a lot to ask of a mower. Gravely commercial mowers are built for all-day performance, helping you get the job done season after season, and ergonomically designed to keep you comfortable mile after mile. Gravely, built to mow the distance. Available exclusively at independent Gravely dealers.
Visit the new location of Myers Equipment and Supply, 301 North Jefferson Street in Dublin.
So diet is one thing. We know that people that are extremely obese tend to have prostate cancer occurring at a younger age and at a much higher grade than people who are thin. So, you know, other elements, leukopene is one thing that's found in red tomato sauces, and you see a very low incidence in a lot of the Mediterranean countries with that, especially Italy, where they consume, you know, red sauces with just about every meal. Zinc has been touted as a good drug for prostate cancer because the prostate is very high in zinc. Yes, sir.
Is prostate formula, is that snake oil or is that the real?
There's some of those things that in there that are beneficial, and a lot of them are just, you know, kind of like old wives' tale. So, but that's kind of the story on. There's not a good way to prevent that, and I tell people, the earlier we can detect it, the better you are. Now, with that said, screening, wholesale screening, which is used to be what hospitals, the month of September is prostate cancer awareness month. And hospitals and used to put on huge prostate screenings every September. What we found that a lot of people were being diagnosed with prostate cancer that didn't need to have anything done. Because if you live to be 80 years old, if we look at the 80-year-old population that dies from a heart attack, a stroke, or getting shot going over his neighbor's backyard fence after being caught with his neighbor's wife, and you take their prostates out, you're going to find microscopic evidence of prostate cancer in almost 100% of people. So when a guy comes in and he's 88 years old and he says, I want my PSA checked, I'm just telling him, well, and sometimes we do it because people want it done. And, you know, it's more of a thing to make them feel comfortable. Although if I diagnose it in a man that age, unless it's what we call poorly differentiated or it's already spread, we don't do anything radical to treat it. Let me ask what question you had, sir.
What I was saying, the Cialis is approved for BPH, so how good is Cialis for BPH?
It's good for the symptoms of BPH, and it really has helped as much as some of the alpha blockers that we use is how it works. Right. And it's a very good drug. As a matter of fact, a lot of insurance companies, when they came out with the report of using Cialis for BPH, they would pay for it for BPH, but not for erectile dysfunction. It's amazing how many patients of mine began having difficulty passing their urine after they found out that out. So, you know. Yes, sir.
I don't have no problem except one thing. We could just went on a trip. Every 50 miles, I got to stop and think. I mean, I don't care what. And if I drink water, I don't drink. But that's since I found out I'm diabetic. And all the medicines I'm taking. I take 11 in the morning for the heart. And I take 4 diabetes in the morning, medicines. Has that got something to do with me going to the bathroom so much?
Well, it could, but the other thing you've got to understand, it could be your prostate, but it could also be overactive bladder. And when we think about, and you hear about overactive bladder all the time, you see the little copper pipe men, and you see the lady that's carrying her bladder by the arm and her bladder's leading her around and all of this. Actually, and most people think that ladies have that problem only. But over 40% of people that are diagnosed with overactive bladder are men. So it may be that you need to have something for that.
Is there a fact that ages your prostate automatically get larger?
Well, it grows in most men and ages. It's not age though, it's the way that your body handles testosterone and how it affects your prostate. That's what it grows from. Prostate enlargement is caused by your testosterone. So
Well, you're right to tell me a little enlargement, but it comes due to my age.
Well, it grows at different rates in all of us as we get older under the influence of male hormone.
Once you've taken Flomax, do you have to take it the rest of your life for enlarged prostate?
Well, if you Flomax or any of those courses, unless you're on, you know, we now have the finasteride and dutasteride, which are two medications that shrink the prostate. So if you do that and it shrinks the prostate successfully, you can stop them. It's not going to spontaneously get smaller, and if you're symptomatic enough to have it, you're going to have something done. Now, there are other treatments for the enlarged prostate that can shrink it, and after it has been shrunk or trimmed out, the old transurethral section of the prostate that we talk about, then men successfully get off of the alpha blockers. I mean, that's the reason for doing that. But I will tell you that I started doing, when I went into private practice, I was doing upwards of 200 transurethral sections of prostate a year. And now, with the drugs that we use and other procedures, some of which are done in the office, I probably do 20 to 25. And that is still a lot for a urologist in today's world. So that's all somebody, yes sir.
Is there any natural way to shrink the prostate without medication? I mean, like maybe exercise and,
Not that I know of.